Hello, my name is Dr. Heather Vandergeest, and I'm a naturopathic physician here in Vancouver. I've done two presentations for this Vancouver Run Summit. The first was on how naturopathic medicine can help either prevent injury and also just ways in which we can help in the treatment of injuries. And this presentation is going more into some of the other treatments that can be used for a running injury, such as using regenerative injection therapies and other treatments that help. So who am I? As I said, I'm Dr. Heather Vandergeest. I'm a naturopathic physician here in Vancouver, and my main area of practice and focus is in pain and injury management and using hands-on therapies and physical medicine to help with those injuries. Not only am I just dealing with the injury that a patient may have, but I'm also looking at treating the whole person. And with that includes looking at a lot of digestive issues and clinical nutritional counseling that I can do to help a patient make sure that they're absorbing the nutrients from the foods that they're eating and eating the right foods in order to help either prevent an injury or to help in the healing process of that injury. A lot also comes into disease prevention and disease management. If somebody has a pre-existing condition, such as an autoimmune condition, these are all things that can wear on the body, but doesn't need to stop you from doing the activities that you love, and in this case, running and training. I also do some work with detoxification and drainage, just in regard to inflammation in the body, not always necessarily with athletes, but it could be. And then regenerative injection therapies is one of my main areas, and I'm going to go into more detail in this presentation regarding that. The modalities that I use include physical adjustments like a chiropractor, lots of hands-on therapy. Acupuncture is another one, nutritional counseling, making sure that people are optimally eating the foods that are going to help in their recovery and health overall. I do a lot of IV vitamin and nutrient therapies, which is having those vitamins injected directly into the vein, bypassing the digestive system and giving the cells first priority over those nutrients to help in the healing process and just overall health and overall health optimization. I also prescribe a lot of botanical medicine and supplements to just help aid in areas that maybe people aren't getting the right nutrition, or if they need a little bit extra over and above the foods that they're eating. And I do hold my prescription license, but I try to use that only when necessary and only for short-term use, because I really want to try and get to the root cause of a patient's symptoms and treat the whole person so that they aren't always reliant on a pain medication to get them through the day. So naturopathic pain management, here's a little bit of a description for you. I like to help people with both acute and chronic pain, whether it be an injury or a pre-existing or a past injury that they've had. Some of the therapies that I use are manual therapies or hands-on physical medicine. That includes trigger point injections, acupuncture and dry needling, manipulation, osseous manipulation or adjustment, soft tissue mobilization, myofascial release, and the injection therapies of prolotherapy, PRP, neural prolo, and neural therapy. And as I said, with those injection therapies and other treatments, I'm also looking at lifestyle modifications to improve healing. And depending on a patient's needs, I also can recommend those supplements and other options to help those building blocks to support the body in its healing process. So here's a little bit more of a description of my areas of focus in regenerative injection therapies, which I'll be discussing, pain management, both acute and chronic injuries or pain, and then the physical medicine with the adjustments, trigger points, acupuncture, and soft tissue mobilization. So in regard to injury and pain management for runners in particular, conditions that I can help treat include runner's knee, Achilles tendonitis, which can be a very common one, and I've seen multiple runners come in with pain in their Achilles due to overtraining, or it may be a tight muscle or kind of imbalance side to side that's causing more strain and stress on the Achilles. Hamstring issues are another big one, foot pain or plantar fasciitis, shin splints, which is kind of like the term for if there is like a stress fracture of the tibia, but it can also be that there's other issues around the lower leg, which are causing that pain in the shin. And those need to be addressed as well, whether it be a tight muscle or muscle imbalance or extra stress or strain going through that area due to a weakness in another area of the body, whether it be in the knee, the hip, or the foot. So we have to look at the entire kinetic chain when looking at these injuries, and it's sometimes where we feel that pain is not where the actual issue started, and we need to actually get to that root cause in order to prevent those further injuries from occurring. Also, a lot of runners get the tight IT bands, so we can do work with that. As I mentioned before, stress fractures. If there is an imbalance, that can lead to lower back pain, hip pain, knee pain, ankle or foot pain. It can also even add to muscle strains or stress due to an imbalance. And so those are things that I like to work on and help the patient with. Piriformis syndrome is another one, which is tight like lower back into the glutes. Deep in the glutes is where the piriformis sits. I work a lot with chronic and acute injury management and recovery. Arthritis can be one, whether it be genetic or whether it be from a previous injury. That's inflammation around the joint. So I do a lot of work with joint injuries, ligament instability or laxity, and then posture as well. And all of the health practitioners on this Vancouver Run Summit I'm sure we'll be talking about postures. So the chiros, the physios, the kinesiologists, naturopathic doctors, the podorthist, the personal trainers, we all are going to look at posture, because if there's something in that kinetic chain or posture that isn't right, that means that another area of the body is taking that added stress, and that's where you may be feeling it. As I mentioned about stress fractures, I can also help with broken bone rehabilitation, and it can happen in regard to runners, but disc herniation, and that can just be that the joint or the spine is where that weakness is, and it herniated a disc in the process, and that can definitely cause some issues in regard to training and just activities of daily living. So those are issues that I can help treat in regard to running and training. So let's get into it. What are regenerative injection therapies? It's considered a non-surgical pain management for orthopedic and musculoskeletal conditions. When I say non-surgical, it just means that, no surgery is involved with these regenerative injection therapies, and these can be used to either prevent or delay the need for surgery. So my recommendation is, if you do have an injury and you've either been told there's nothing else that can be done, or you definitely need surgery, please look at all the options that are available. And this webinar is to also help and just educate you on some of the other treatments that are available, and so that you can make an educated decision and the best decision for your health and your body as to what needs to be done for your injury. With regenerative injection therapies, it's not usually just done alone. I use it in conjunction with manual and physical therapy, hands-on therapies. And many people use those when they get an injury, but when those are no longer effective and surgery may or may not be an option or wants to be avoided, this is where regenerative injection therapies can fit wonderfully. These injection therapies can also provide long-lasting pain relief. So the regenerative injection therapies that I'm going to be talking about today include prolotherapy, which I'll describe next, platelet-rich plasma therapy or PRP, neural therapy for scars or surgery, or after surgery, perineural therapy, also called neural prolotherapy, which is inflammation around a nerve, and so we're trying to decrease that nerve inflammation. And then IV vitamin and nutrient therapy or infusions, and that's the injection of vitamins and minerals right into the vein so that the cells get first priority over those nutrients to help in the healing process. And that can be used if there is any digestive issues or we're not absorbing enough of the nutrients. IV nutrient therapy is a great way to get more of those vitamins into the system to help with the healing process. So what is prolotherapy? It's a natural and effective treatment for both acute and chronic pain and arthritis. And it's using the body's natural healing ability to relieve that pain. It also helps to strengthen injured tissues and restore function in the area. It has over an 85% effective, it has over 85% effectiveness in most cases, and that can further be increased with adding good quality diet and nutrition, making sure to get adequate rest, and other therapies that can be helpful in the rehabilitation of the injury. Prolotherapy is a great treatment if you have an acute injury that's not healing in a timely manner, or you've had a long-term injury that continues to bother you, either feeling unstable, so ligament or joint instability, or if there's still pain in the area. It's not a one-time fix-all type treatment, and most treatments aren't. It does take injections every 2 to 4 weeks to get those maximal results. So the process of prolotherapy is an injection into the injured ligament, tendon, or joint with a mild irritant solution, such as dextrose or sugar solution. What this does is it causes controlled inflammation in the area, which then triggers the body to give it a second chance at healing and actually start that healing cascade. If we think about it, our body's not going to heal an area or injury until there's actually an injury there. And that's started by inflammation. So inflammation can be very important in that healing process, but what we don't want is that inflammation to always be there, because then the body almost doesn't have the resources to help decrease that inflammation as well as heal. So controlled inflammation is what we're aiming for, to allow the body to start that healing cascade. With that inflammatory healing cascade, it's going to generate new, healthy, stronger tissue, which has a significant impact on that chronic or nagging pain. And when the function is restored, the pain also tends to dissipate as well, because inflammation causes pain. So in general, regenerative injection therapies, these are conditions that respond very well to those regenerative injection therapies. That includes chronic or acute joint pain or injury, plantar fasciitis or foot pain, Achilles tendonitis, hamstring issues, arthritis, knee and hip pain, even a torn meniscus. And that's a hard area to treat, because when there's not a lot of circulation into the meniscal or cartilage areas of the body. And when we use an injection therapy, we're actually targeting that area to produce that inflammation so that the body brings more circulation to that area and can bring cells to help in that healing and repair. All of the injection therapies are also great for lower back pain. And as I mentioned, even sciatica, which is inflammation of the sciatic nerve, which runs down the leg. So if people are feeling that sharp or lightning type sensation down their leg, that can be a sciatic nerve issue. And we do have injection therapies to help in decreasing that nerve inflammation, which will help stop that kind of zapping sensation and irritation to the nerve. In regard to running, also the SI joint or the sacroiliac joint can sometimes be a place of instability. And so injection therapies can help actually tighten up those ligaments in that area to help decrease that pain. Degenerative joint or disc disease also responds very well to injection therapies. And IT band syndrome, so whether there be a tear in it or whether it's tight and there's trigger points, that's another great use for it. And also muscle strains. If there's like a small tear in the muscle, if we're adding the injection therapies, we can target that area to help in that healing process. That also includes stress fractures, ankle and foot pain, such as a sprained ankle, shin splints, unstable joints, and then ligament laxity. So that's a picture of a knee injection. It looks worse than it is, and it can help a lot of people, but it is an option for treatment. And I'm really hoping that this webinar really just helps to educate you on the different types of treatments so that you can make the decision that's best for you. So now on to platelet-rich plasma therapy. So PRP is performed by harvesting the platelet component from the patient's own blood. So we draw a vial of blood and we spin it down and we separate the red blood cells from the platelets, which includes the growth factors, stem cells, white blood cells, and other healing cells that are in the blood. And we separate those and we concentrate them and re-inject them into the injured area so that that injured area has a large amount of healing cells to help in healing the injury. Platelets are a specialized type of blood cell that's involved in injury healing, and we're directly injecting that into the source of the injury or pain. This technology has been available to help many patients who have either failed at conservative treatments or are either wanting to delay or prevent the need for surgery, or if surgery is not an option for them. PRP usually it's a number of treatments between 4 and 8, but it really, I say those numbers loosely because it really depends on the person, how they're responding to treatment, and what the injury was to begin with. So most of naturopathic medicine is very focused on making an individualized treatment plan that's right for you and your condition. So key factors that are really important in the success of PRP or any regenerative injection therapy includes the patient's overall health, any pre-existing conditions that they have, what their nutritional status is, and also hormone status. If hormones are out of whack, that can really play a role in how the body is able to heal or not heal as efficiently. When comparing just PRP or the platelet-rich plasma therapy to the prolotherapy, which I discussed before, it's generally one PRP treatment is as effective as 3 prolotherapy treatments. So prolotherapy is cheaper upfront as a cost, but sometimes you do need more treatments in order to get the same result, because we're actually injecting the patient's own platelets back into that area to help start that healing process. This is what PRP looks like. It is a golden yellow, I call it liquid gold. That's also what it can sometimes be known as. And the picture on the left is my centrifuge, which actually separates the red blood cells from the platelets. So perineural therapy or neural prolotherapy is an injection that's used for nerve irritation. When a nerve is inflamed, that's when it's going to cause that irritation, which causes that shooting pain. So when we do an injection of dextrose or sugar, plus a local anesthetic such as Procaine, along the course of that injured nerve, it helps to reduce and eliminate the pain and inflammation. So sometimes if there is that nerve that's inflamed, we can add these injections around the nerve to just help settle it out. The anesthetic can also be very important in this, because when that anesthetic there, it's going to remove the pain off the bat, but it also just changes the pain signal to the brain and actually stops that pain signal while that anesthetic is in the system. And that is going to, reprogram that pain response signal to the brain. And it actually is giving that, that signal a break, which can also help in the pain management side of it. So these are just drawings of what the nerves look like and where they trace down. And so when people have pain in a certain area, I will draw out where that nerve or where their pain is going. And then that allows me to better inject into the areas that are causing the most pain for the patient to decrease that nerve inflammation. Now, neural therapy. So the previous treatment was neural prolo, that's for nerves. And neural therapy is used for scar treatment. So if anyone has had a previous surgery or they have a scar, when we have a scar and they're tying it up or they're sewing it up, they're actually taking all the different layers and sewing them together in order to seal up that wound. But in there can sometimes lead to taking other tissues and fascia with it, including nerves. And so some of those nerves may have been cut during a surgery, or all the different layers, including the fascia, are all tied up into that surgical scar. And that can also lead to pain. So with this therapy, we're actually able to break up some of that scar tissue underneath to allow those underlying layers to heal and rejuvenate. And that even includes rejuvenating a nerve that may have been cut. Nerves do grow back in some cases, and this is a way to just allow all the different layers within the body, the fascia, the muscle, the nerves, even like the fat and all the layers in between. It allows those to all move independently of one another to allow for the best type of movement and also healing, because sometimes a scar can actually be the reason for another area of the body having pain. And it's because it's kind of been pulled in that scar area, and there's a trickle down effect that's actually causing pain in a different area. So if pain's not improving, one of the things I look for is scars that a patient maybe either forgot that they had, or that may be blocking some of that movement of the tissues below it. So when the skin is cut due to an injury, the wound may heal in a way that creates a short circuit between, as I said, severed nerve fibers. The signals aren't transmitted properly, and that leads to a disconnect. And that pain or that scar, that non-tender scar, may be that silent or asymptomatic reason for having pain in another area of the body. So when we do this neural therapy, we're injecting just Procaine or an anesthetic, which helps to anesthetize and also rewire that area and break up any unneeded scar tissue underneath. Conditions that are well treated with neural therapy, including adhesions or scars. Low back pain, it can be great for. Sometimes we have little like micro scars due to an injury that we may not have known about inside the body due to a muscle tear. Remote pain or disturbance in the body. Pelvic pain works very well with neural therapy. Scars in general. You can even use it for migraine headaches, depending on the type of headache. Surgical scars, like I said, as well as nerve pain and irritation. Next is orthopedic adjustments, or adjustments like you would see a chiropractor do. And we're really correcting that stress or malalignment of muscle, connective tissue, and the skeletal system. Trigger point injections are areas where the muscle is kind of bound up that causes a point of tenderness or pain. Many physios and kinesiologists will do trigger point release, acupuncturists, as well as chiropractors. We may even use acupuncture to help trigger points, but there's also injection therapies for trigger points where we can actually allow that muscle to relax depending on the solution that we use when we inject. This can also be called myofascial work, but trigger points is the more common name. So we're treating a painful area of muscle that contains the trigger points or knots in that muscle. And when those knots are there, it doesn't allow that muscle to relax. Trigger points can be helped or removed by using massage, acupuncture, and again, as I said, the injection therapies. Acupuncture and dry needling is another great use, another great way for pain management and injuries. It can be used for pain, stress, addiction would be something that we use more acupuncture in a different sense, but in regard to physical medicine and pain and injury, we're using thin, tiny acupuncture needles to stimulate a specific point or an unwanted symptom. This machine here that's pictured on the right is electroacupuncture. And what it does is it sends a small bit of current through it to help actually just cause that muscle to contract. And in a way, if that muscle can't contract anymore, it finally lets go and releases. So this is another way to get rid of trigger points or to help with muscle tension in an area that the muscle's just holding on, is if we can fatigue it and allow that muscle to finally let go. So that electric current passes through the needle, and we usually put it in acupuncture points or trigger points to just help cause that muscle to let go and release. IASTM, or instrument assisted soft tissue mobilization, can really help with soft tissue or pain in the muscle. So what this metal instrument is doing is helping to strip that muscle in a way to get all the fibers moving in the same direction again, and to actually get rid of trigger points as well, soft tissue adhesions, and just get more blood flow and circulation into the area. Circulation is key for bringing the blood cells that we need to help in healing, but also that extra blood flow is going to cause that exchange of nutrients to bring good oxygenated nutrients to that area to help it in an optimal way. So it's bringing circulation, it's stimulating a small local inflammatory response. You will be red after the treatment. Same with like a cupping treatment. It's just bringing circulation to that area to help the muscles let go and arrange back in the direction that they should. When there's a muscle that's tight, the fibers will go in all different directions rather than being all in a line. So that's what this instrument can help with doing as well. And it's just another tool that we use to help with pain management. So conditions that the instrument-assisted soft tissue mobilization is used for can be for neck pain, again, plantar fasciitis. So this may be something that we start with before we move to the injection therapies, because my goal is always to start from the least invasive and move to more invasive treatments as we go, making sure that we don't miss any steps in the process. Because if we can kind of just massage an area to get rid of pain, I'd much rather do that than going into an invasive treatment when it may not be necessary. So neck pain, plantar fasciitis, rotator cuff injuries or tendinitis, patellar, this is a great area around the knees, great treatment for around the knees to help with tendinitis, or into the shin, tibialis, and the muscles in the lower leg, so tibialis posterior tendinitis. It's great for heel pain and Achilles tendinitis. It's great for hip pain, post-surgery, because it's going to bring more circulation to that area, which will help also break up scar tissue. Myofascial or muscle pain or knots. It can be great for MSK or musculoskeletal imbalance. Chronic joint swelling or sprains and strains is just bringing circulation to that area to help heal. Ligament strains, muscle strains, bursitis or inflammation of the bursa in the knee or the elbow. It's great for knee pain, back pain, trigger points, hip pain, IT band syndrome, for really just kind of stretching that out. It's different than rolling because we're actually getting into that muscle to just help realign the fibers, moving in an up and down direction. It's great for shin splints, ankle and foot pain, ankle sprains, and surgical scars. And that concludes my second presentation on regenerative injection therapies and other treatments that can be used for a running injury. If you have any questions, please reach out. I would love to answer them for you. And here's my information below. And I really hope you enjoy the rest of the Running Health Summit presentations. And if you haven't checked out my first one on how naturopathic medicine can help you in your training, please check it out. Thanks for watching.